So good morning, good afternoon, and good evening. And why I'm telling that? Because participants from different area, different zone, different time zone has been joined with us. And we know there are people from Philippines, there are attendees from Fiji, there are attendees from India, Malaysia, as well as from UK and South Africa. So in different part of the world, there are different time zone. So I am telling all of you a very good morning, very good afternoon, and very good evening. Welcome to the third and final day of Second International Conference on Industrial Organizational Psychology 2022. So today we have lots of tremendous presentations, tremendous keynote speeches. We will start with psychospiritual approach in stress management, which will be presented by Dr. Nasir Muhammad, who is a professor of Faculty of Medicine in Sultan Jainal Abidin University, Malaysia. And later on, we have several presentations on action research, which are currently going on in cutting edge industrial area in Bangladesh. Like there is a presentation on PIP, Performance Improvement Program, and there is a presentation on workplace well-being management from USEP Bangladesh. And we also have a very nice presentation on executive coaching and mentoring, which will be presented by Vivek Yatnalkar from India. And he is a PCC, Professional Certified Coach from ICF, International Coaching Federation. So a very interesting and enrichful and resourceful day ahead. With this note, I would like to welcome our all the keynote speakers, as well as our guest, our chair, Professor Dr. Hamid Akhtar Begum is also there. So we are starting this session, and I am giving the screen to Professor Dr. Nasir Muhammad to present his keynote speech on psychospiritual approach in stress management. So Professor Nasir, the screen is yours.
Right. Good morning and good afternoon, and also good evening to all of the participants, the distinguished panel. First of all, I would thank Mr. Salim for allowing me to be in part of this conference. And I hope that from these sessions, it's going to be like a new networking establishment between all the experts in the field. So the topic today is about the stress management. And as we all know that with this pandemic era of COVID, there's lots of events that make a lot of changes, especially emotionally situations whereby whether you are a worker or you are at home or anywhere, you'll be much affected by stress, especially the COVID, something new. And now onwards, probably this be more very challenging problem that I think and it's very important if we discuss it, we discover it, explore it. Therefore, we can make early interventions to avoid it from become something that very dangerous. Because why? WHO predicts this millennium, the most risk mobility is associated with suicide and also the mental problem. So today I would just would like to share with you a very important approach for us to to aware, and therefore we can make early intervention if we face any problem with stress. Okay, so which part of the photos belong to us? And I think in this time, probably for us, the first one. But for the rest, we can have a different, manifestations of a stress level. So we hope that if you know how to tackle it, we can make like the first photo. Everybody smile, even though we have problems, we still can smile. Why? If you not, learn to improve our, emotions later on, if we come to something that it might affect your life. So it's very distress. Okay, so stress is any change that creates physical, emotional, or psychological discomfort. So individual may respond to stress differently. It depends on the what be the threshold of stress that you can cope, and how you counteract with the stress, how you get adopt with the stress, and how you overcome it. So it's different from one to another individual. So if you know how to identify it, how to respond it, probably it'll be good, especially in this era. Everyone is very, very fear of being infected by COVID. And then, why? Because why? Till now, we don't have the actual treatment yet for this problem. So that's why we are so worried. Even now, there's a lot of limitations, social distancing, or whatever. It's not something that new. So although stress is a fundamental to survival, it's also strongly related to several brain disorders, including depression, anxiety, and also the post-traumatic stress disorder. These are the common problems that we encounter or we face during the previous year. And furthermore now, it become a very stressful years since the past 2 years. However, the stress actually is something that good actually be taken positively. Why? So the positive stress would encourage individual to adapt and improve the adaptive skill level, raise individual awareness against the problem, and also they have become stronger in terms of survival if they can take it as positively. Why? To improve themselves. If this is such condition, you take it, then the stress will be good for you. However, if you take it in a negative way, it can affect the performance of individual, because it is beyond the individual ability to cope with that. So it affect individual body system, whereby the more cortisol, stress hormone will be released in the body. It will affect the metabolism of the body. It will triggers the sympathetic actions, whereby you will get the it will associated with hypertension, the coronary artery disease, and also other stress condition that might affect your health. So these are the topic that guide, people don't want to be, those who cannot cope with stress, they end up with hypertension and also coronary artery disease. So it also will affect the behavior or creates a physical problem. You become weak, fatigue, malaise, you cannot, respond in a good way, especially, and also the performance. You feel sleepy, and then this is something that not good for you, especially in the workplace, whereby you're dealing with something like a machine in the factory. It might injure your fingers or anything, and you can fall down in the machines and can create a very bad effect. So factor of stress, it basically affected by the emotional, environmental, and also physiology. So the emotions that everyone know, if you're stressed, you can feel, you can look at your face, or the wrinkles on the the face, not a cheerful face, a very sad, very like you have problem for the environment. You cannot cope with that. You cannot, you can't bear with the noise, the hot weather, or extreme cold weather. You cannot, your body cannot function it very well. And in terms of physiology, also you have a problem with the eating, with the sleeping, your metabolisms and everything. So it's very bad effect actually. So demands exceed their personal or social resources, the individual is able to mobilize. So this if it's something to do with the emotions, and also make you difficult to adjust or modify with the adjustment of the behavioral. And also stress is not what happened to you, but how you react. Why? Because we cannot avoid stress sometimes. So we have to know what are the stresses, and also how to cope with that, and how to remove it from us. So there are three things. We must able to recognize it, we must able to cope with it, and also we must know how to, to overcome, to make stress like a very enjoyable moment, whereby you can see that if you are stressed, your performance or your achievement is better. Uh, uh, Without, because why? Sometimes stress is very, very important for us to make us more achievable in terms of KPI, right? So what are the changes, or the event, or good or bad, these are the things that might change your life. So there are a few things like you lose your spouse, there's separations, or you have family problem, you're being you lose your job, and you think about your financial income, you have broken a family, and problem at work, and also social factor like social distance, and also during the COVID, you can see that everybody stay at house with the crowded environment. There's no time for them to talk each other. Everybody is like do their own work with the with less communication because of the problem with the MCO. So these are the things that might affect the performance, and people tend to have more problem with the the stress that they have. Okay, because of the demands of today's work environment, pressure at work is unavoidable. We cannot avoid now because of the situation, because of the COVID pandemic, everything. So now we can avoid. Last time we think that we can run away from the pressure, but now we have to face the pressure. But how are we going to face the pressure? Because while some individual may be able to work and learn very well, and motivated, making them accepted the pressure and adapted to it. Whereas majority cannot. Majority cannot. Some individual cannot handle the burden of workloads everywhere very well. So it causes the uncontrollable pressure and stress. Like frontliner, those are those are working during this COVID MCO. The help, the nurses, the police officer, the firefighters. They are work in a stress condition, and 77% or more than 2/3 of them end up with this problem, with depressions. They cannot perform the work very well, and it lead to the negligence, and those who are dealing with the dangerous items, they may not with the morbidity. So this is something that very dangerous, especially it affect all, not only to certain group of people, but all a group of people. Per work organization, work design and management, unsatisfactory working condition, and lack of support from co-workers and supervisors can all contribute to work-related stress. So the teamwork is very important here, and understanding. We are not going to achieve anything if we cannot coordinate in terms of the few levels of working staff or level of department. So coordination is very important, communication is very important, understanding is very important. Because why? It would be better we solve the problem even though it's a bit delayed, rather than we're not able to complete the mission or the work very well. We need that. There's no production in the end. If we cannot do it, it's better a late but safe and come up with something very good, rather than we cannot get anything in the end. So another problem is that the expectation and pressure that are not matched to worker knowledge and skill. This is actually we partly resolve this problem. This is probably the old time before the COVID era, but with the skills development, with technology now, we partly improve in this part. Except for if we have very effective or very efficient coordinations of the work, meaning that the leadership of the organization is very good, then probably we can handle it in a better way. Okay, different workers look at the different scope of job differently. So this is the key role of leader or manager of the organization to make sure that everyone is understand what is the mission and visions, how they can work together. This is not individual performance, but it's a group performance. This is a very important key to solve the partly solve the pressure that they have. And everyone should have give hands. Everyone should give hands based on their, whatever they know, what are the experiences they have. They should give hand and help each other. This is not even, even though in the hospital organization, one doctor cannot work himself alone. It must be further supported by the nurses, the attendants, the specialists, the director, and everyone should give hands, and no such blaming attitude among the level of of worker or expertise. Meaning that we should complement each other. Everyone should complement each other to make it a successful mission. This is something that we should change, especially in the bigger organization, structure. And everyone should have a similar aim, similar aim, a similar target, and they should, cooperate each other. They have to improve their communications and whatever. All right. So with that, we have to understand, before we enter it, we have to understand why this is important. The process of dealing with stressful situation involve complex mechanism. Integrations of the brain and body. Even our body itself, also we cannot work alone. We have to work together with the brains as the, the starting point. It will give effect to the other parts of the body. So it's very important. So as we all know, the identification of stressor leads to activations of two major. There's a sympathetic adrenomedulla axis that secrete noradrenaline and also norepinephrine. And another one is the hypothalamus pituitary adrenal that secretes glucocorticoid, which is the pathophysiology in the slower or long-lasting response, whereas the prior one is with the pathophysiology of the rapid response or immediate response. So once these axes are activated in response to a given stressor, they will generate and coordinate response, and the hemostasis restorations will occur. So okay, this is basically the summary of the the flow of the response and the mediator release in the body, and how it affects the body and how it being regulated to get adapted with the stress that they have. So stress response promotes energy mobilization. So it's good. You look at this one, it's a positive point. The stress response promotes energy mobilizations, metabolic changes, activations of the immune system, suppressions of the digestive and reproductive system. But it's not good. It's not good because why? It can secrete more hydrochloric acid in the body, and those who cannot cope with the stress, they will have the gastritis, they will competitive ulcer disease. So they will come up with epigastric pain, abdomen pain or whatever, and sometimes they can take the medicines to cure the thing until they had developed complications such as the upper GI bleed and also lower GI bleed, and their performance at work also not in a good way, because they are normally feel lethargy, sleepy, and so this is something not good for the worker. And this body brain effect mediate alteration in physiology and behavior that enable the attention and survival. If they can cope, we can adapt it. Slowly, it become a good mechanism for them to improve themselves, especially in terms of response and also skill, right? Okay, these are the physiology part of what happened for the stress. So it affect this is something to do with the oxidative stress also. And you can see that when the cortisol is released, it can block the inflammation. So what happens that it can suppress the immune cells. That's why during this COVID era, we must mentally, emotionally good to cope with that. We're not in a fearful conditions. We are well prepared. Say that if COVID come, we treat as like normal common flu. We take supplements, which is a lot. We go to hospital early, get early treatment, think positive. Inshallah, you get protected from the very bad side effect. But if you are stressed in the beginning, your health is not good, and then probably your immune cells also not functioning, not working very well, and that's it. When the disease come, it may deteriorate very serious and very drastically. That's why we can see that many with the immunocompromised situation like diabetes mellitus, obesity, elderly, so they cannot tolerate this infection, whereas others can drink very well. Okay, for the chronic stress, the adrenal gland release high cortisol to inhibit inflammation. So this is something not very good actually. Something is very good. So we have to try to improve that. So here again, I put it in the diagram. What you get it when you have stress. So you got pain, non-specific pain. You got migraine, you get the neck pain, back pain, muscle pain, everything. The stomach upset because they increase the hydrochloric acid secretions. You emotionally, you cannot. It's not stable. Forgetfulness. Feel weak. Malaise. Less of focus. And also, it also may associated with overreacting, overeating, obesity, and also easily angered. When it's stimulations, something that you cannot cope with that. Of course, it will affect the libido also, or you cannot perform because of the lack of libido. Okay. So how? Preventions of stress. So actually, if you look at this all the answer for that. We must have the knowledge. We have to learn. We have to adopt with the, we have to choose the healthy lifestyle, healthy food, everything. Support from the family. You can talk to someone, listen to someone, share the problem, share your experience how to handle the problem. This may release partly, and certain people they cry. Only with crying can help you release 50% of the problem that you suffer by crying. And of course, those who have good religion practices, they can cope with that. Especially there are few approaches, a way how to cope with that in a relaxed manner. So probably we can share with you after this our hands experience how to cope with that. Okay, for us here, we choose to have a healthy food here. We got, here, if you come to Malaysia, known as the heavens of food here. Welcome to Malaysia after this. If there's no more restriction, please all of you come to Malaysia. You can enjoy lots of foods here. You can get Bangladeshi food here, Pakistani food here, Indian food here, Japanese food here, Americans, the Western food here, and of course the Southeast Asia foods also like satay, everything. So very, 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 very good place for you. Please come to Malaysia after this. Enjoy our foods here. Make you happy, make you relax. So we have plenty of a variety of foods here that are probably suited to all, of course. And you must leave that which makes you doubt. Because why? And one how to say that. So whatever, if you're not sure what you eat, probably will look the uncertainty. You'll be more, you're not confident. But if you take something that very, you know where the sources of this very clean, halal, and you feel safe. You feel safe, you feel confident. And this is the starting point. If a good food, got halal food, so it make you enjoy anything, includes your both physical and also emotionally and also spirituality. This is a starting point. If you're good, the correct foods, you don't, then probably it will make your, contribute to very health of body or a good, functions of your body. And also here, you can see here, since my topic is more on the spirituality condition, if you can control this, of course, we try to avoid this one. But if you need that, probably you must take it. But we try to avoid it. If everything is controllable, you can control spiritual, because you know what? Spirituality can control your hormone level, your higher function level. So if you have good this one, and the rest will be easier. All right. Okay. So another one is that we found another interesting research from Japan, whereby they found that fasting is other methods of make can improve your body function. Why? Because even certain cancer cell with the fasting can kill the cancer cells. This, if you have time, you're interested, please go through this a journal from Japan. Is won the Nobel Awards for this finding for fasting cure. This one autophagy concept. The healthy cell will eat the unhealthy cell. So this is good. So our health is very important as the key and the primary point of managing stress. And we must have a good food, good food for the good health. Okay. Okay, now we go to the how to manage, how to cope with the stress. So basically, I divided into 4: biology, psychology, spiritual, and sociology. And these are the things that we have in our setting right now. Everyone will have these 4 principles. Everyone will face this, will have this, and they have to treat based on this. Whereby the biology one will involve the healthy diet, healthy, I'll take the medication for those are disease, got disease, and also therapy. So it's just the biology. I give example. If you're hypertensive, you want to work in a factory, of course, it's not suit for you. So you must treat the problem of hypertension. So by taking medicine, and also must have a good diet for you to make sure that everything is controlled. Therefore, you can focus in working in that kind of environment. And psychology, you must have a good, strong support for the, must have a counselor. Who is the counselor? Even your spouse can be a good counselor if they have the ability of listening. So counselor is very simple. You just have to have someone to listen to. Or if there's nobody there, you just go to the mirror and you talk yourself. This will be a good counselor for you. But you must tell someone. You cannot keep in your heart. This is very important. Because why? If the stress in your heart, you don't tell anybody and it becomes worse. It can get worsening. So you must go there. Certain people, they cry. But certain people, they talk. So who? The question is who you want to talk to. If your counselor is good, if your counselor, you just go to the restroom, you get your mirror there and you talk yourself, right? That, or you selfie, you put on a video, you just tell what in your heart. Therefore, it get released. So probably 70% of the problem can release with that. It's very simple. So everyone should have their a counselor, whether a self counseling or with your spouse or your other family or with the professional counselor. And the third one, the spiritual part. This is very important because why? My focus is a psycho-spiritual. Number one, you must know when you need to be treated. When you feel that you cannot focus on your job or your work, you cannot control your emotion, and it's time for you to get the thing released. Who? Your counselor or yourself. So this is number one. Number two, the spirituality part. You must have the, the practices, what you do normally to make sure that your emotion is stable. So in our region, probably in other regions too, but I'll talk in my place. Basically, we have the what called the heart purifications, meaning that we have to faith, repentance, the hope of God's pleasure. You must be patient, and you must keep it sustainable. You must repeat it every time. So even we come up with a self-reflection tool apps, whereby you can make a self-monitoring of yourself, how you perform today. If you identify yourself, you have 100 stresses. In the end, before you go to sleep, how many percent release already? And everyone should release the stress before they go home. No, you shouldn't bring the stress to your home, to your house, to your family. Before you go home, before you drive your car, get the thing released. How? You cry, you make efforts, you do some things or whatever. When you release and go home. Therefore, the pressure that you have in the workplace, it will bring back to your house. At least 90% or 80%. Don't bring home. If you bring home, then your family will have the consequence of bad, effect of the stress. And of course, sociology. Sociology is very important. Why? Because the family and community support, and you have your friends, you chat with them, you have drink with them, not drink alcohol, but drink something, juices, tea, coffee, have a chatting with them in a healthy manner. It's something that you can share, improve yourself. We must have such a culture that we need the sharing of good and learning of a new things to improve ourselves. I think with this, vicious cycle, you cover biology, psychology, spirituality, and sociology. Sooner or later, everything will get out from your heart, the pressure, whatever. So you take it as a good, a learning process whereby you have to improve yourself for a better survival. Okay, medication for stress. Currently, there is no specific medication to treat stress because, if you look at the stressor, you get the causative factor. Basically, it is manageable. You not even require medicine, actually, the chemical medicine, actually, to treat the stress, actually, if you know what are the stressors that you have, what you're going to have. So you don't have to take medicine, actually. The antidepressant most widely prescribed for anxiety, such as SSRI, such as Prozac, Zoloft, Paxil. Actually, if we look at the literature, it will associate with side effects of the drugs. Even the poor performance, sooner or later, you take too much medicine. So I think it's not a good one. Even though I'm a medical doctor, I would suggest that everyone should know how to cope with the stress using the psycho-spiritual methods. This will be the best, the safe, and less expensive. It's not expensive at all. You don't have to pay, actually, if you have a good, if you know the how to cope with that. But the best one will be this counselor who understand it very, very well, the concept. If not, then probably the one that I do just now, you must have a friend who want to listen to to your problem. It's good. So it's your spouse, your wife, or your family. Yeah, this is a very good one. Okay, because why this drug, we don't have the clear mechanism of action and the causative factor. So actually, when using the drug, of course, it will affect the the hormonal changes there, and probably few receptors be blocked because why we believe that certain hormone can induce or can reduce the motivation. So that's why drugs not good. It can suppress, right? Okay, so the best one is the psychospiritual therapy. Yeah, meditation. For Muslim, they use the zikir, repetitive, like mentioning about the names of God repeatedly. You make your heart feel relaxed, comfort. And for certain people also, with prayer, they forget every problem. Any problem they have, they will forget it. And we treated it after they make a prayer, they cry, and get released. So I think it's something very cheap. Everyone should be able to practice it with comply to what what religion your religion teach you. Yeah, because why lately we can see that people away from their religion, they are not practice religion, they are no longer practice religion. That's why their way of, their way of life a bit miserable in a way. Okay, so meditation, what is meditation? The practice of focusing your mind in silence, especially for religious reasons, and in order to make your mind calm. A wide range of movement in the variety of practices along with its specific purpose. So spiritual meditation can be defined as any particular movement or practices that have a sacred connection and meaning with self and universe or others. Please go through this journal. You can look at this one. So I think it's very helpful. It's very helpful. Spiritual meditation shows strong evidence in reducing the anxiety, stress, and depression recovery symptoms. Even one study done in Indonesia, they make a comparison those who are practices meditation regularly and those who are not. They found that those who are practice meditation regularly associated with increased the antibody level, and they're unlikely to have a flu, ill, sick, or whatever, and their performance of academic performance are much better. Those are practices meditation regularly. So the key word is that you must have a way of performing your meditation regularly at a scheduled time. You cannot do once a month. Cannot. You probably can do half an hour a day regularly for you to release all the stressor before it coming to a stage that you cannot cope with that. So you can release, and you'll be happy. Because why? The stressor is always with you. You cannot run away from the stress. Okay. After that, there are several technique mechanism that demonstrate on the how. First of all, the simple way is a breathing technique, ventilation technique. You're stressed, you just ask a deep breath in, hold for a while for a few seconds, and you release it. You release your pressure. You take a deep breath in, assuming that it's all the pressure in your side, in your body, and you try to cope with that. We hold for a few minutes, and you just imagine you release all such pressure from your soul, from your body. You release it slowly, slowly. Not to rush, but slowly within few seconds. You take, you hold, and you release it. You do it frequently, probably 10 or 20 times every 3 to 4 hours. You can do it on your chair while doing your work and get it released. And also with mindfulness and contemplate mind. With your mind, you control, you just imagine, and then get it cleared with the ventilation. Okay, so it can be something like a mantra, meditation, zikir, and doa. You make a prayer also. So it depends which one that you comfort with your choices. So you just do that.
Mm,
And also, I speak movement, meditation movement also, movement, the hand, the head, the body is, you feel that, you do something. And I think, believe me, you get something and you feel something good for you. Even yoga also good. Yoga, I can see that at the airport, in Canada, there's a place for them for the yoga. You just bring your yoga mates there. You can do the yoga also at the airport. So while waiting for the flight or whatever, or while waiting for something you have nothing to do, you just sit down and just do a simple movement. So breathing is the most, I think, agreeable methods that easily done. Everyone can do this. Okay. Okay. After that, for us, we have few way of performing. Like we listen to the preach, which can influence your emotions. We can cry, make a wish, make a doa, and we just say the names of God. We recite, the Quran. And you can, those who are whoever your religion that you believe in, just practice it. It's good. It's good. If you're Muslim, you read Quran, you make dua, and you always say that Alhamdulillah, thanks to God, thanks to God for all the kindness, all the mercifulness or whatever that you have it. Okay, for Muslim they perform salat. This is a movement actually. Is yoga adopt with this movement. In yoga also, and in Muslim they perform salat, for a few seconds. So you can do this movement actually, and you feel that, wow, even you have a back pain, you get released with this movement. So please try to it. Okay, so we Muslim, we practice 5 times a day salat. Certain people they make yoga once a day. Before they go to sleep, they make yoga or twice a day, early in the morning and after, before they go to sleep. Wake up and after. All right. Okay. And then actually a light exercise during the midnight, not the aggressive one. Because why? Aggressive movement might endanger your heart, but light movement, exercise, whatever, or you just make a self-reflection is good for you. So I think probably if there's a questions or whatever, probably I can respond it, even though it's depend on the chairperson whether question is allowed or not. But I think we are towards the end, because why? Allah does not burden a soul beyond that it can bear. So meaning that everyone here will face stress, we have problem, and believe me, the problem that you face, inshallah, you can bear with it, you can solve with it. Nothing much then, except for you must know how to tackle it, who would like to consult to, and when you must make a immediate action or response toward this problem. So with that, I think I end my sessions. I hope that if there is a question, we can respond, allow, or if not, probably any comments from the floor or whatever. Thank you very much.
So many thanks, Dr. Nasir, for your nice presentation and very much insightful and resourceful. And you have opened a new way, like to us, to see stress management. Like we all usually do such type of rituals and religious activities, but the way you have related and scientifically present this relationship with religions and other spiritual activities, that is really great. So at this point, we have among us Mr. Tsukuyoshi Kawakama. I would like to request Tsukuyoshi to say his view, to share his view on this stress management, psychospiritual stress management technique. I would like to request him to tell something about it.
You are calling to me, Tsuyoshi Kawakami. May I share the screen? I think still the PowerPoint of the pretty.
Yes. Sure, please. Anik, Anik, please allow him to share the screen.
Okay,
Yeah.
now? Yes. Yeah, I don't know, you can see me or not? Maybe not. But anyway, actually, the organizer already gave me 3 questions, So I'd like to follow that instruction. So maybe not directly relating to, the professor's presentation, but relating to that, I'd like to add my views and the ILO views from the viewpoint of workplace stress management. I think the professor, provided a very good, overview, and there was also specific and practical issues, how to cope with stress. Then now we can a little bit more focus on the workplace stress issues. So I think first question, the organizer gave me is what are the global impacts of workplace stress, the workplace level. So I think everybody now understands the stress level in the workplace really increasing. But there are not many overall reports, but I found some EU reports. They said 50 and 60% of all lost working days are because of stress. So meaning many workers suffer stress and then did not come to work, could not come to work, and then 22% workers have stress. And also, in Japan, you may know, we have a lot of over-fatigue suicide issues or over-fatigue problems. They work too hard, too long hours, or they have difficult human relationships with maybe some stress from the bosses, and also over-demanding, etc. So they get the depression, then could not come to work, or finally some of them attempted suicide. I am now staying in India. I'm from the ILO office in New Delhi. I found also because of Corona situation, that many Indian workers also lost their jobs and the difficult conditions of management. So they are having more stress. So causes stress is complicated job contents, long working hours, difficult human relationships, harassment, etc., etc. So, and also physical symptoms can be related to the stress. Like back pain, most frequent one is back pain, shoulder pains, or headache. So we should also pay much attention to the physical working environments because that can also increase stress. Okay, the next question the organizer gave me was, how does a pandemic situation affect the overall stress? So I know under the Corona pandemic, actually stress of many people really increasing, because they have some specific backgrounds or reasons. First one, fear of getting infected at work. So many workers, or also managers, employers, when they come to their work, they have to be very careful to avoid infection. And also overwork, particularly, some emergency response workers or healthcare workers, as you know, and also maybe some production areas, some delivery workers, they have a lot of, over demand. So they have be engaged in the overwork and the long working hours. And also we should not forget the violence and the harassment things, both physical and psychological. Of course, most eminent one is, violence harassment against healthcare workers, as you know, because doctors or physician nurses, they are helping treating COVID-19 cases. But some other people, they harass them. Or they should not come back to my area. They should not come to my apartment. So maybe this happened. And of course, work and life balance. Many workers working from home, including myself now. So it's very difficult to balance work and life. And also many workers worrying about the job security. They might lose their jobs. And so management, leadership, also they have a lot of stress because of the changing market situation. Oh, we lost many customers and we cannot deliver our materials. And also temporary change of labor law, a lot of requirement, OSHA requirements. And the communication information, a lot of fake news, the COVID-19 is a kind of, kind of manipulated by someone, or the vaccination is dangerous, a lot of fake news. Also negative coping behavior, because now many people stay home, so maybe they might have some alcohol, more smoking, or poor eating habits. They eat a lot, too much, and they increase the body weight, no physical exercise, and also lack of social support. So these are, very specific issues, stress, stressors under the COVID-19. The last question the organizer gave me was this one. any global policies have been taken regarding this issue, the workplace stress? Yes, of course. So for example, I know we have been working very hard on these issues. ILO report work-related stress in 2016 is maybe very comprehensive. You can find it very easily on the website. That emphasizes very important point. We should integrate psychosocial risk assessment management as part of occupational safety and management systems. Because many enterprises, workplaces, they did an excellent safety and management system, the risk assessment, but not to necessarily include psychosocial aspects. So this should be included. And also very more recently, ILO, they published guidelines on managing work-related psychological risks during the COVID-19 pandemic 2020. That can also provide a checklist and then a lot of guidance. Then also the last point, but maybe this is most practical. ILO, we have published stress checkpoints. You can also easily find from the website. That provides very practical ways and the checklist, how to manage work-related stress in the workplace, covering leadership and the justice at work, how to control job demands, how to provide more job autonomy and control by workers themselves to decrease stress, and how to promote social support, and how to improve physical environment as also as a stress factor. Work-life balance and working time, recognition at work. If workers they did good job, we should praise them, recognize them. And there's some protection from offensive behavior like violence, harassment, and also ensure the job security. That can really stable the worker's psychology. And of course, correct information and the communication, and they just avoid the fake news and the bad news. Okay, so these are my response to the question to organizers. Okay, thank you very much.
Thank you, Suyoshi Kawakami from ILO, and such a nice and very specific to the point. Thank you for that. So we have among us Professor Dr. Hamida Akhtar Begum, who is the chairman of this conference, as well as she is the Pro-VC of International University of Business, Agricultural and Technology. So I'd like to request Professor Dr. Hamida Akhtar Begum to say his view regarding this psychospiritual stress management issues. Madam, Dr. Hamida Akhtar Begum, madam.
Okay. Thank you very much, Mr. Salim. And I am really very much enthusiastic about the presentations that I have had learned. And the first speaker, that is Dr. Nasir bin Mahmood. Fantastic presentation. Thank you very much, Dr. Nasir bin Mahmood.
Yeah, thank you, Prof.
Yes?
Yeah, thank you very much.
Okay. You have presented the entire field of stress within a very short time. What you have not touched upon, you have touched upon everything. So if I go through the sequence of your presentation, you started with social situational factors. Then, as you are a doctor, so you spent some time of your presentation on physiology of stress response, the body-brain effects, and then you turned your discussion to symptoms of stress, prevention of stress, etc. What fascinates most the audience is what should we do to get out of the symptoms of stress? And you focused on meditation. That is the most important part of your deliberation, I would say. I am also a Muslim, so I do agree with what you have said in your presentation. Okay, stress, as you said, professionally, I am a social psychologist. So while talking about stress, I actually take the view of Carl Lewin's field theoretical approach. So we individuals are in a social situation, with all our characteristics, with all our physiological and psychological characteristics, our needs, desires, everything in a particular situation. Here, the most relevant situation that we are talking about is the work situation. So in the work situation, whatever our tasks are, we are there as total individual. Our physiological, our emotional, our social relationships, everything, with all aspects, we are there in the field, surrounded by an environment which in this particular international conference we are stressing on is the work environment. So naturally, we are interacting with the work environment, the work situation, which creates the stress. So stress is viewed as an individual's reaction to the immediate work situation. But we have, as you have suggested, that we should have a global view of the individual. And you are very right, I agree with you. We have seen that a lot of cases of burnout. Burnout is a condition, as you have not talked about it at full length, but we know that burnout actually is a consequence of continuous stress that we often notice. So, and this continuous stress in the work situation, may we compare it with the stress that we are going through in COVID situation? Okay, that is also creating a continuous kind of stress. So, and research has shown that, anatomical evidence of our brains, I'm not a doctor, you know it better. So it actually affects our entire body, particularly the brain, the sympathetic nervous system, parasympathetic nervous system, and also the endocrine glands, right? So as we have learned through research that there is anatomical evidence that the brains of burnout patients are showing chronic stress. So it is a stress that does it. You mentioned about amygdala and the associated parts of the brain that are affected, and emotional turmoil actually leaves marks on the brain. So it is behaviorally manifested, but the root is at the brain. Again, if as a social psychologist, I think that the process starts from the social situation. And here we are talking about the work situation. Whatever we are experiencing in the work situation around us, whether there is lack of support or not, whether there is anybody to talk to or not, that is an important aspect that will actually leave its effect on the brain ultimately. So it is the total individual that we are talking about while we are talking about the causes of stress, how to manage stress, etc. And when we are talking about the total individual, we are not only a social being, we are also a religious being. We have some faith according to the religion that we believe. So naturally, that gives us a point of treatment, okay? And I know that those who believe in God, whenever they pray, a lot of stress is released. So that is the spiritual thing that happens. It has a very important therapeutic effect, okay? We do advocate counseling when we are in stress, no doubt about it, but it is we have to know ourselves personally. And when we are aware of the things that actually soothe our mind, that actually, encourages us to be patient, etc., we have to find that out. And one of the ways is that through prayer, that whatever religion we believe in, through prayer. So actually, Dr. Nasir has touched upon everything. I was fascinated by the diagram, biology, psychology, sociology, and spiritualism. So that is the totality that we are talking about. So whenever there is any burnout, in the workplace, we have to take resort of that, how it is, that particular diagram actually explains everything. So, and research has shown that in the past, there has been a lot of research where we have found that the executives in the business, the HR directors, they often suffer from burnout. Okay, so it is primary cause is situational cause, that is the work situational cause, but it brings its actually trace on the body of the individual, the mind of the individual that we are talking about, and that body and mind of the individual has a sorry about the interruption. That body and mind of the individual has a long history, and it has all the past history. It has the attitudes, the values, the beliefs, etc. Everything makes it up. So what kind of therapy is necessary to get out of this, consequences of our stress, that we have to find out, okay, individually. So it is the responsibility of the individual as well. Okay, it is the responsibility of the individual to find out course of action that is necessary when we are bogged up with the stress situation. So thank you very much, Doctor, for talking about spiritualism. As I heard from the second speaker, Mr. Kawakami, that is the global impact of the workplace on stress. Yes, and particular emphasis has been given on the global impacts of work stress. How does pandemic situation affect the overall stress? Yes, we have seen in Bangladesh also, a lot of research have been done, and it has shown us that is how fear of getting infected actually affects us. Sometimes, some people were so afraid that they abandoned their very loved ones. Okay, so that is not very common thing to happen. Why it is happening? I was really surprised to see some of the cases that I read in the newspaper, and that is really, really threatening for us. So stress can cause so much of effects on us, and the person himself who has reacted that way will be amazed to ponder over it when the burns of COVID goes away. Okay, I think so. Okay, so there has been also so many social consequences, like early marriage of girls. That is happening, early marriage in Bangladesh. Okay, so this is because of the uncertainty the parents are going through, and that is causing stress, and they are getting their young daughters to marriage, despite the fact that it is prohibited, legally prohibited in our country. Violence that has increased, and there are a lot of research to show that violence, particularly sexual violence, has increased, and this has happened in our country as well. Not to talk about job insecurity. A lot of people lost their job, and economically they have been affected tremendously. Okay, but somehow we managed food security to some extent. That is our experience in Bangladesh. That food security is there. People are not dying out of hunger. So the social climate is such. Others are helping. Those who are in well-to-do families, they are offering their help, and that is the benevolence that has been shown by individuals, by the community. That is really praiseworthy. And I'm sure that this has happened in every corner in other countries as well. Okay, so we have seen the positive and also the negative aspects of the COVID. That is actually all these make us put the individual in a balanced situation and to find ways how to get out of that particular stress. Talking about work stress here, okay, the technology has been an asset for us. Like say, for example, Zoom way of communication that has increased, and well, there are so many things that we can talk about it. The positive thing about it is that at least some mode of communication that is there, that is important, okay, and it is reducing stress. Online services of counseling, say for example, that is much appreciated in releasing our stress. And in Bangladesh, as well as in our neighboring countries, we have seen that online services of how to get out of stress that has increased. Online counseling services have increased. So all these avenues actually have flourished as we have gone through the COVID situation. Okay, and we have learned a lot from the COVID situation. I always say that we have learned a lot from COVID situation, how to manage our stress. Okay, and I think the pressure on the job that has also been reduced to some extent. I don't know, the business people will be able to talk about it better. Okay, but it is my apprehension, or I really think that pressure on the job that is not that has not increased. Rather, it is the insecurity or the sense of insecurity coming out of losing job that might have increased, but not due to being overburdened by work. That is not there. But one sector of society who have gone through it miserably, that is the physicians, the nurses, the workers in the health sector. So I don't know whether there has been any research started yet on the burnout of physicians, the doctors, the health workers, etc. They day and night they have been working and undergoing stress, and the consequences must have been very, very tremendous. Okay, so I would suggest that our researchers do some research, serious research in this particular field. That is the burnout of the people working in the health sector. Am I taking too much time?
Okay, madam. We have another presentation on action research.
So I should stop here. Okay. So
Okay.
I must express my heartfelt thanks to the speakers that I heard so far. Really, really very excellent presentation. Thank you very much.
Okay. Thank you, madam. Thank you very much for your summarizing speech. And you also have covered all the area also. And the most attentive part that you have specifically noticed the psychology part, sociology part, as well as the physiological part also here, as well as you have acknowledged the part that has been presented by Kawakami from ILO, and what are the actions that has been taken from the ILO also, that has been covered. So thank you, madam, and thank you, Professor Dr. Nasir bin Muhammad, as well as thank you, Mr. Suoshi Kawakami from ILO for your nice presentation. We are ending this session here. We have another action research paper presentation from USED Bangladesh, which is on workplace well-being management. We will just take 2 to 3 minutes for the preparation, and within 2 to 3 minutes, we are coming back. So stay with us. We are there. Thank you.